Nigeria's Center for Disease Control and Prevention has reported a surge in cholera cases.
As of the 24th of June 2024, a total number of 1,528 suspected cases and 53 deaths.
Cholera remains a significant public health challenge, particularly during the rainy season, when water sources are more susceptible to contamination.
Cholera is a sudden and acute diarrhea disease caused by eating food or drinking water contaminated with the cholera bacteria. At-risk populations include children under the ages of 5, residents of urban slums due to lack of adequate infrastructure and limited resources resulting in poor public hygiene, residents of internally displaced persons camps also due to lack of hygiene facilities, residents of flooded areas because floodwaters overflow sanitation systems and contaminate the environment and water sources. ICAP Global Health staff in Nigeria seconded to the Nigeria Center for Disease Control and Prevention (NCDC) through the C19 RM project. They have been supporting the agency to strengthen public health systems, particularly through evidence-based and data-driven processes, which in turn would influence policies, recommendations and messaging content which promote positive health behaviors and address knowledge gaps around priority diseases. To achieve these, ICAP Global Health Nigeria staff conceptualized online and community polls aimed at drawing information on the knowledge, attitudes, practices, and perceptions of the population around different diseases. To pilot this process and show what could be achieved in the country, ICAP supported the NCDC to conduct knowledge, attitude, and perception surveys in Cross River and Taraba states on 3 disease areas: Lassa fever, cholera, and COVID-19. The feedback was well received by the NCDC and the states. The results informed the production of radio dramas addressing knowledge gaps deduced from the polling results.
Okay, make it hear me. To prevent that is sorry. Okay, make it hear me. To prevent this disease, we need to take the vaccination. This na injection will be say when you take, it's not gonna allow you catch the disease again.
ICAP C19 RM team again saw the need to address knowledge gaps before disease outbreaks by conducting these surveys ahead of outbreaks, using the NCDC disease calendar as a guide. And so, in May 2024, the team supported the creation of questionnaires, which was then deployed across NCDC Facebook and X, formerly Twitter platforms. The online survey was timely as cholera outbreaks were being reported the following month, and the results from the surveys was disseminated at meetings of Cholera Emergency Operations Centers, which was activated in June, to help inform activities in risk communications and community engagement, including online messaging content on cholera, disseminated through NCDC social media platforms, reaching thousands of audience online. From June 2024 upwards, cholera cases and deaths were and are still on the rise, with 5,951 suspected cases and 176 reported deaths resulting from cholera. ICAP C19 RM team again went into the field with the NCDC to conduct CAP surveys across 20 states covering the 6 geopolitical zones in the country, collecting over 16,000 responses across the states. These polls informed the development of the Cholera Community Engagement Guide, being deployed to the states in the 6 geopolitical zones where the surveys were conducted, and to be used by the state public health officials, especially the health educators who work in communities. Upon revisiting some of the states the surveys were conducted for dissemination, ICAP observed the health educators putting the guide to use.
So a ti sọ nípa ilé ìpè àwọn tọ́lẹ̀tì wa náà kárí pé à ń clean ẹ̀ ní gbogbo ìgbà. Ó ṣe pé lè yí àgbẹ̀ sí tọ́lẹ̀tì kò flush, àbí lè yí àgbẹ̀ sínú pọ́tì kò empty ẹ̀ sínú tọ́lẹ̀tì. Kí ẹ tí wọ́n wá kún gbogbo ẹ̀, ẹ má jẹ́ ká ṣe bẹ́ẹ̀ o.
Àwọn baálé wa náà lẹ̀ o, gbogbo alájọ nílé o.
Àtàwọn baálé wa náà ẹ jẹ́ má jẹ́ àdáwọn ìyá wa.
ICAP, through the C19 project in Nigeria, remains committed in its support in promoting positive health behaviors in the population, addressing misconceptions and knowledge gaps, as well as strengthening public health systems through the government of Nigeria.